Welcome to Pulse on Politics, rooted in place but expansive in scope. This podcast keeps a finger on the pulse of political currents shaping our region and the nation at large. We share bold voices, real stories, and zero spin. I am your host, Tamara Graham. Welcome to the conversation. Hello, my friends. Welcome back to our bonus series, The Big Ugly Breakdown, where we are breaking down H.R. 1 that was just pushed through Congress and Senate and signed into law by Trump on July 4th of all days. This is episode 2, Health Systems and Reproductive Rights Rollback. Yes, there is more. This isn't a rerun, my friends. We already tore into SNAP and Medicaid, where this bill guts food and health coverage. Now we're digging deeper. This episode brings ruthless clarity to how the one big ugly bill erases essential public health protections and reproductive freedoms even further, taking aim at pregnant people, LGBTQ plus folks, disease prevention, and critical medical research. We're going to start with the domino that starts the collapse: provider tax cuts. Before this bill, and currently, 47 states use what is known as provider taxes, up to 6% levies on hospitals and nursing homes to qualify for federal Medicaid matching dollars. This system doesn't just fund payments. It keeps rural hospitals and nursing homes alive, and it stabilizes local care, even in counties where a single hospital might serve tens of thousands of people. After the passage of this bill, the cap is going to be slashed to 3.5% by 2031, the result being a federal savings of $89.3 billion over 10 years simply by shrinking the tax base feeding Medicaid funding. If you're thinking $89 billion is just money, think again. Rural hospitals run on margins around 3% or less. Take Kentucky, for example. The state is expected to lose $12.3 billion in federal Medicaid funding over the next decade, potentially shuttering 35 hospitals and killing 33,000 jobs. Not to mention how many people it's going to kill. Clinics in places like Webster County, Nebraska, they already serve populations in trailers and shared spaces. Now these emergency rooms will lock their doors, leaving families to drive 30, 45, 60 minutes to the nearest care. Nationally, more than 600 nursing homes and hundreds of rural hospitals are now projected to close. Let's look at the Great Lakes Basin region. Specific examples. Here in Michigan is expected to lose at least $6 billion in Medicaid hospital funding over the next decade, enough to endanger dozens of rural hospitals and forces provider staffing cuts and service elimination statewide. In nearby Ohio, Iowa, Indiana, similar declines in provider tax capacity is going to ripple through rural systems that are already fragile, just like gaps are already emerging nationwide. Community-level impacts in the Great Lakes Basin will echo the tragedy of Kentucky: closures, long ambulance drives, and minute-long delays that spell the difference between life and death. What does that feel like? It's the minute-long delay that makes a stroke disabling. It's the missed heart attack that leads to a funeral. It's the ambulance that's rerouted an hour away and never makes it in time. Picture this. You live in a rural town in Michigan's Upper Peninsula, say Newberry, 5 minutes from your hospital. You know the nurses by name. Your family's savings check from Medicaid helps cover the treatments that once felt out of reach. That support came in part through NIH funding, federal dollars meant to keep rural healthcare afloat. But now, your clinic announces it's closing next month. Staff, gone. Ambulance, reassigned. And just like that, the safety net holding your community together vanishes. Because $89 billion in budget cuts adds up when your community is built on Medicaid reimbursements and your local hospital runs on pennies. It means your grandma trips in the driveway and there's no ER left to take her to. It means your baby's routine checkup, canceled. Or worse, your baby's choking and you're calling for help that isn't coming fast enough. No ambulance, no clinic, just you. And if you can't save them, they die. It means the nurse who just quit. She's not replaced. There's no one left to show up, no staff to train, no backup waiting in the wings, just a hollowed out building and a town left behind. This isn't just about budget cuts. This is the collapse of public health as we know it, community by community, life by life. Now let's talk about disease prevention cuts. The walls around us are crumbling down. Before this bill, the CDC and the NIH operated as our nation's frontline against disease, with a combined budget of about $58 billion a year. That money funded everything from pandemic preparedness to vaccine research, mosquito surveillance, because, mosquitoes carry diseases, right? Cancer studies, and emergency response teams, even in rural counties where health threats can emerge unnoticed. After the bill passed, the lifeline is cut. $18 billion will be ripped from the NIH research and $3.5 billion slashed from CDC programs for a total reduction of about $21.5 billion in health defense funding. If you think $21 billion is abstract, think again. In states like Georgia, Texas, Colorado, local public health agencies are losing nearly 10% of their screening and outbreak response capabilities. Laboratory surveillance is gone. Mosquito teams shut down. That leftover breathing program discontinued. Imagine this. Mosquito season hits hard. A strange fever starts spreading in a mobile home park outside of Grand Rapids, Michigan. No one's tracking it because the local public health office was defunded. By the time the hospitals catch on, it's too late. People show up dehydrated, shaking, confused. They're dying before anyone knows what they are dealing with. And that's just the start. You feel this kind of collapse in your bones. It's a mother's cancer screening delayed until it's terminal. It's a virus ripping through a nursing home with no early warning system left. It's a town stripped of its first line of defense, exposed, vulnerable, and forgotten. Because the wall that once held the threat back, the one that most of you don't even realize is there, they tore it the fuck down, line by line, to feed billionaires. And now the consequences are going to bleed out. Now let's move on to reproductive and trans care cuts, rights that are being torn to shreds. And before I dive into this section, there's something I need to say, and it matters. Democracy is uncomfortable, my friends. Freedom is uncomfortable. Why? Because real freedom means living in a society where every single person has the right to exist and to thrive, even if their choices, their identity, or their lifestyle make you uncomfortable. Freedom doesn't mean everything aligns with your personal beliefs. It means we protect the rights of others even when we disagree. If someone isn't harming you or infringing on your rights, not as an individual, not as a community, then they deserve to live fully, safely, and freely. That's the baseline for any society that dares to call itself free. And yet this bill does the exact opposite. It targets people simply for existing. It strips away care, dignity, and basic bodily autonomy, as if that hasn't been taken away enough. And not because of harm done, but because of who someone is. This isn't about public safety. It's not about fiscal responsibility. It's about erasure. And nowhere is that clearer than in what this bill does to reproductive care and to trans lives. Before this bill, Medicaid and CHIP supports over 1.1 million patients annually at more than 600 Planned Parenthood clinics, providing birth control, abortion care, prenatal services, cancer screenings, and gender-affirming care. Trans youth rely on Medicaid for hormones, therapy, and surgeries. More than 2 million patients are served every year at these centers. Roughly 4.2 million STI tests and 270,000 pap smears are administered annually at these centers. Planned Parenthood alone helps prevent over 516,000 unintended pregnancies every year. And that's not just a statistic. Unintended pregnancies are linked to higher maternal and infant mortality, delayed prenatal care, and lifelong health complications. These services save lives, plain and simple. But after the bill passed, federal funds are stripped from these clinics. Roughly 200 Planned Parenthood locations are expected to close, and gender-affirming care completely defunded under Medicaid and CHIP for all ages. Now, here's the part I want to be clear about. Some of the numbers you're about to hear come from external impact analysis and not the bill text itself. Organizations like the Human Rights Campaign have projected that over $2.6 billion will be lost from gender-affirming care programs and more than $30 billion from reproductive and LGBTQ+ health initiatives. These estimates reflect what happens when you eliminate funding streams, not just what's written line by line. You can read more about that in the HRC's budget breakdown at the link I provide in the show notes. So if you're thinking that this doesn't affect you because you're not trans or pregnant, think again. Imagine a clinic in rural Pennsylvania that serves 5 counties shutting down overnight. Teen girls lose access to birth control. Pregnant women search for affordable ultrasound options that no longer exist. Trans youth, especially Black and brown teens, get cut off mid-transition. No doctor, no therapist, no one. Mental health, unaddressed. Care, gone. These aren't just closures. They're disappearances. And every closing clinic isn't a statistic. It's a person losing protection, losing support, and sometimes even losing their life. Let's move on to eligibility redetermination. Every 6 months, every life at risk. Before this bill, Medicaid eligibility is checked once a year. If you hit a bump, move, lose a job, have a baby, you have time. A notice comes. You have 60 days to fix it. Most people stay covered. Now they've doubled the red tape. Eligibility checks every 6 months. Postpartum coverage slashed from 90 days to just 30 days. No call, no grace, no safety net. Imagine this. A mother in Detroit gives birth. She's still healing, still bleeding, still trying to breastfeed. And on day 31, the hospital hands her a $22,000 bill because her Medicaid expired silently. One form didn't arrive. One letter wasn't translated. One mailbox never opened. Or picture a rural family barely making it. Their child finally starts speech therapy. And just like that, it's canceled. No warning, no appeal, no options. This isn't bureaucracy. This is policy designed to disappear you, to vanish your care behind a wall of fine print. It's not just paperwork. It's people's lives, for Christ's sake, cut off with a signature and a shrug. Oh, well, you should have. Fill in the blank. So what does this all mean? In short, this bill attacks health at its core. $21.5 billion in public health cuts leave diseases undetected or ignored. $30 billion plus in reproductive and trans care cuts not only erases rights, it erases dignity and lives. Twice yearly eligibility reviews turn Medicaid into a trap, not a defense. This isn't policy, my friends. It's a blueprint for abandonment, dismantling the safety net in silence, piece by piece, town by town, life by life. The hunger, the fear, the despair, it's all written into fucking law. All of it. And tomorrow, there's even more. Because episode 3, we break down how billionaires get richer while students fail. Student loans and education. With the passing of this bill, they are cementing generational poverty. This is episode 2 of the Big Ugly Bill, Health System and Reproductive Rights Rollback. Thanks for listening to Pulse on Politics. If this episode moved you, challenged you, or lit a fire under you, share it, rate it, and keep the conversation going. Visit us at GreatLakesPulse.com to read our latest magazine, where we celebrate the Great Lakes Basin region with amazing adventures, stunning photography, high-profile content, and more. Follow us on social media at Great Lakes Pulse to stay connected. And don't forget to visit our Love Where You Live Foundation and support the initiatives that matter most: protecting mental health, uplifting Indigenous voices, and preserving the waters and spirit of the Great Lakes. Visit lovewhereyoulivefoundation.org for more information and to donate. Until next time, my friends, stay grounded, stay alert, and keep your finger on the pulse.